Hello, everyone, and welcome to another episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we're diving into the high stakes, fast paced world of emergency medicine. It is a field where every second counts, decisions are life changing, and resilience is key. And joining me today is Dr. Siddharth Anand. Dr. Siddharth is well regarded for his expertise in handling critical emergencies, coordinating multidisciplinary teams, and managing the immense pressures of emergency medicine with professionalism and compassion. We're thrilled to have him share his insights on what it truly takes to thrive in this demanding field. So, Dr. Siddharth, welcome to the podcast and thank you for taking the time today.
Hi, Hatri. It's so nice to be here.
Thank
Uh,
you.
and really thanks a lot for his, interesting introduction over here. Although I'm quite old in emergency medicine now, I am practicing emergency medicine from almost 6 years, and it's just an interesting field to talk about.
Yes,
I'm happy to be
definitely.
here.
Yes, and I'm sure it's like a fast-paced industry of healthcare as well.
Definitely, it is one of the most fastest. I'm right now. I'm managing my time in critical care also. So, frankly speaking, emergency medicine is one of the fastest lane of medicine. What I see, critical care is much more slow, much more, giving you time to interpret a lot of things. But in emergency, you really have to be fast.
That is so rightly mentioned. Now, doctor, let's dive straight into our conversation. So, can you walk us through a typical day in your life as an emergency medicine specialist, and what does the start of your shift usually look like?
So, I mean, being a doctor, you know end to end, you generally have the same kind of shift. Just the difference is that at least in emergency medicine and critical care, you have set number of patients whom you have to address, and you then generally don't do your OPDs, so you are more of like walking directly into your department
Mm.
where you will be seeing the patients. And sort of like, when you are sitting in a OPD, patients are coming to you, but over here patients will be generally on the bed and you have to go to the patients. So more of your shift starts generally with a handover. So emergency is a place which never stops, so it is like a 24 by 7 place. So you will have patients all the time. So basically what happens is that once you are moving into your shift, what happens is the previous doctors who were taking care of the patients, firstly, they will be giving up the handover. So handover in emergency medicine is very specific. We do have, certain handover tools and set number of datas which we have to tell the other doctor, because this is the one of the most critical part, where you are not just giving the handover of a shift, but giving the handover of the care of the patients also. So you need to tell almost most of the critical points about the patient care and treatment part, which a doctor should be knowing to continue the care of the patient later on. Then once you have the handover, you would definitely take like 5-10 minutes to settle down into your department, figuring out that who are the most critical ones. Generally, every emergency department nowadays, at least wherever I have worked, we have our beds coded. So they are coded according to the acuity of the patient. So the more sicker ones will have one zone where we would have beds coded with red color or something, or maybe code one beds. And then we would have some zones which we would like to call it like yellow zones, where there are like less sicker patients would be there. And then there would be code green zone areas where walkable or OPD kind of patients can be addressed. So we also set up our day like that firstly we will be like to giving a little bit of extra time to the most critical patients, and seeing what are the things which we have to immediately act on. Sometimes what happens is that maybe the patient has arrived in a good state, they are in yellow zone, but sometimes they get sicker, so we have to move them from yellow zone to red zone. So those kind of things, firstly you go through the whole department, look over all the patients once again, and figure out whom do you need to give the most of your time in that phase. Secondly, definitely, one thing which is very different in emergency than critical care is that the patients don't stop coming in. So you have to definitely manage at one side the continuity of care of the patient, but at the same time you have to manage starting the care of the patients too. So if you are working in a heavy loaded emergencies, then you definitely gonna have more patients coming in, and you have to address them too at the same time. So you have to sort of balance your time between managing the critical patients too, and at the same time figuring out who are walking in, are there any critical patients whom I have to immediately address, and plus at the same time those patients who maybe are not that critical, but they need the healthcare support for that moment of time. Sometimes, in the night, 12 o'clock OPDs are not open. So you will be able to, you need to, see patients who are having fever also and who are dying also. So you have to figure out how to manage your
Managing,
time equally.
prioritize.
Yeah. So prioritizing is definitely one thing which is very important for emergency physician. And side by side, emergency is a happening place. So you do all one in one zone, you are managing the critical illness, in one zone you are stabilizing the basic ones, and then in one zone definitely you are seeing those patients who needs most basic of the healthcare demands, but then you have to discharge them too at the same time. So you are admitting them, fixing them, and discharging them too. You are admitting them and moving to the right zone in the hospital also. And that's how generally a emergency medicine physician's day looks like. And then again the shift gets over, you do the handover thing again and you go home.
So it's definitely a very busy day, I suppose. And managing, as you mentioned, is very important for emergency care physicians.
Mhm.
Uh, Now, doctor, let's explore the emergencies you encounter every day. So, what are the most common types of emergencies you encounter, and how do you prioritize care when multiple critical cases arrive simultaneously?
So, coming to the point of what sort of emergencies we see top to bottom everything, whatever you name it in your body, we see it. Just the thing is that we see the core of the emergency part. Like there is a saying for medicine, emergency medicine specialists, that we are jack of all and master of resuscitation. So, I mean, old days saying was this, that jack of all but master of none, but actually it is not true. Emergency medicine physicians are jack of all definitely, but at the same time we are master of resuscitation science. So resuscitation science is more of like, seeing the most critical ones and how to revive them and give the support in that, golden period of time, so that you can fix them and at least
Mhm.
stabilize them in this manner that they can continue with the later part of the healthcare and eventually their lives get saved. Coming to the point of emergency, I mean, we do see neuro emergencies like or even sometimes headache too. Headache is also something which is a very common presentation in emergency. Definitely, headache is a Pandora box. It can come from brain bleed to a normal headache to a migraine, any sort of thing. We definitely see a lot of chest pain patients. So chest pain is one of the commonest emergencies. We see heart attack in layman term, in medical terminologies we say MI. And we do see other kind of heart related emergencies like acute heart failure, or even in the sometimes in once in a while you would see cardiac tamponade or these kind of things too. You definitely see trauma patients. Trauma patients would be like from top to bottom, anything could be involved with trauma. You can have a neurotrauma, you can have a spine trauma, abdominal trauma, anything related to trauma. So you are seeing fractures, you are seeing bleeds. Side by side, as an emergency physician, you are definitely seeing gastro patients, abdominal pain. You are managing the pain also, you are making the diagnosis. The pain could be due to renal stones, kidney stones, the pain could be due to gallstones, the pain could be due to infections also, abdominal infections. You are managing a normal gastroenteritis, which in our Indian layman term we call it the loose motions and all. So we do manage those kind of a spectrum to this level of a spectrum where a patient might be dying because of, you know, abdominal complaints only. And other than that, you definitely see pediatric patients too, and you have to address gynecology too. So basically, emergency
Everything.
medicine is a place where you are seeing everything. That's
Yeah.
why it is called jack of all, because you are knowing the emergency part of each particular specialty, and that is your core area that you need to at least address the most emergent situation of that particular specialty. The only thing is that in this particular specialty, the very critical part, the resistation part, is something which we have mastered very well. So, if I am standing there, I would not be afraid of a patient who is not, who's coming to my emergency and who just got hit by a truck and he's not breathing or he's breathing in a labored manner. I know what all things needs to be done for this patient. So that is something which we handle day in day out. How to handle it is another science which is called triage. Basically, triage is in one way we can call it, prioritizing the patient according to the level of care they need. So every emergency department have their own triage system. Generally speaking, if we see it in other countries, they have a national triage system which they follow. Over here, we follow generally, sometimes some places I have seen they follow Australian triage system, some places they follow UK triage system. But end of the day, the whole point is this, that you divide the patient according to the level of acuity the patient is walking in, and then you decide whom to see first. Just for an example, if you know you are having four patients at the same time in your emergency, one patient is complaining of chest pain, one is complaining of fever, one is just not breathing right now or breathing very labored, and fourth one is just having a twist of ankle. So but all the four are the patients, right? For them, they need a doctor immediately, but the doctor is, suppose, some emergencies are big, they have at a time 3 4 doctors. Some emergencies may have one emergency doctor at a time only. So that is the time when you need these coding systems. So there will generally be a nurse or even sometimes a doctor who would be doing the coding of the patients, and we can even code them according to the color also. So like code red is like the immediate one who is having a breathing difficulty or a chest pain, and then code yellow could be a patient who need definitely a care, but he can wait for for next 15 20 minutes. And then we can have a code yellow, code green also, where the patient is just having a very minor problem and he can wait up to 30 minutes. So at least this is the most basic coding system which we use in emergency departments all over our country, and this is how we sort out and see the patients.
Yeah, I think that is so incredible to hear, and I think also working under pressure is something that emergency physicians would be very prone to, and prioritizing again, as you mentioned, is really important. Is key for them. So now the next question would be. Yeah, so in emergency settings, collaboration is very crucial. So, how do you coordinate effectively with multidisciplinary teams, including surgeons, nurses, and even other specialists at times?
I think so. That is all embedded into the emergency medicine specialty itself. Once you start working into a department and have your training done in emergency medicine, you sort of build this inherent habit of how to involve people and when to involve people. Frankly speaking, there are two ways we generally involve. One is when we directly call them, and the second one is some good emergencies have a coding system also. So some type of patients we do have code system where, suppose if the patient is having this kind of complaint which needs very immediate action, so we have built-in code systems in our emergency. Just for an example, if I would say, if a patient is walking in with chest pain and I get an ECG done of that patient, and that ECG shows me that the patient is having heart attack, I don't need to call the cardiologist and then the cath lab technician and everybody one by one. I just need to pick up the phone, uh, call the central helpline number of the hospital and ask them to activate code STEMI. So once the code STEMI will get activated, it will be announced inside the hospital everywhere on the speakers. Along with that, a call will be given directly from the control room to the cardiologist and their team to get ready with the cath lab and everything, because here the time is the most crucial thing for the patient. So this is one way of collaborating, which is generally, very unique, and it makes everything into a very streamlined flow. So that helps us definitely to enhance the care of patients who have the time critical zone, like in a stroke, also paralysis patients. If they are walking in, we have very strict time guidelines to treat them. So we have code stroke for them. Even if trauma patient is walking in, you need, to do multiple things at the same time for a severe trauma patient. So that's why we have code trauma in emergency. Then if you announce the code trauma, a general surgeon, a plastic surgeon, a neurosurgeon, a radiologist, all will directly come to your emergency department without even calling them. So that way, you have a lot of help at your hand, and that's how you work it out to save the life of the most critical ones. At the same time, once you are handling the basic patients, emergency medicine, as an emergency specialist, you should know the art of firstly, making the differential and the diagnosis, and then after, the art of talking to the doctors and how to let them know that this is the patient who need the care of their specialty, and that's how it all moves in.
Yeah, I think teamwork is also really important, and I think, as you mentioned, that the emergency care physician should first know what to do and then transfer it ahead. So yes, I think that is really important. Now, doctor, let's talk about balance, because that is also something which is very important. So, how do you balance the urgency of treating patients with maintaining empathy and compassion in such a fast-paced environment?
Empathy is, I think, so still a very big term, and this is something which is of a very inherent quality to any person. What I feel like, just being a doctor, we talk about empathy a lot in our day-to-day meetings, day-to-day, conferences, that we need to build empathy and all. But what I personally feel like, after working day in day out with so many huge number of doctors and healthcare professionals, nurses, emergency medical technicians, and everybody, that it this is a quality which comes definitely with your inner way of thinking also, and plus with once you start having the experience in this zone, because once you start having a lot of experience with the patients day in day out, you will definitely start understanding their pain also. So personally speaking, once you start gaining experience, especially in the emergency medicine, your empathy part definitely grows. I think so. It's not just with emergency medicine, but with medicine itself. Because once you start understanding how the medicine works and how the treatment part works and what all the whole journey of the patient is, that's where you start understanding, okay, these are the sufferings my patient gonna have, and this all are the things which I can do to enhance his journey and reduce his sufferings. So that kind of thing, is all about how much more you are deeply connected to your patient, giving him more time. Language is definitely one thing very important, what I feel like in this zone, that you should, if you are working in an area where your language is the one which patient is also speaking, then it makes your life really easy, and it makes you understand them better. Just a common terminology of pain could be very different for different patients. So speaking their language, sometimes, trying to be friend with your patients to understand what actually they are going through, is something which is a art of medicine. It will come with time only, and you need to be at the bedside. You need to be near the patient. You need to spend time day in day out with them. You need to spend time with your team also. Team building activities, going out sometime with them. These kind of things also definitely build up your team. You need to understand what your teammates are going through. Maybe sometimes they would have their own personal challenges too. So how you are supporting them, how they are supporting you. These kind of things also definitely, help you build a good empathetic emergency department. And I think so, it's never bad to lend an extra hand to your teammates, even to your patients sometime, because we need to understand this, that in this specialty or even in medicine itself, this is the place where we go and we care about somebody who is just like us, right? In any other field, if you go, you are working with computers, you are working with systems, but over here you are working with human beings. So you need to know that you once you are walking in, you are definitely going to impact
Hmm.
something which is directly connected to another human being. So that is why, this is a place where you have to have that sort of little, even if not a lot, but a little bit of feeling definitely towards your patients. Definitely, you can't be have a lot of feelings, because then it will become
Hmm.
difficult for you to work for your patients in a very hard situations. Sometimes we do have to make difficult decisions for the patients too when they are critically ill. But at the same time, you need to understand their sufferings and help them out in whatever way possible.
Yes, I think that is truly inspiring, doctor. And I think even taking small steps towards empathy is also really important, I feel.
Hmm.
And now, doctor, we all know that emergency medicine is known for long hours and high stress. So, how do you manage burnout and maintain your mental and physical health?
Uh, l- Long hours, I mean, the way we design our emergency rosters or duties, we generally tend to keep it less hours, but more frequencies so that we can have extra time for rest.
Mm.
But definitely, demand is something which is at the extreme in this specialty. Once you walk into the department, you will see patients everywhere, and they all just want your attention. And you cannot, be partial to anybody.
Mm.
So definitely, it is one of the most demanding specialities, and you will gonna have burnout. It's not like that. There is any elixir or any secret which you will do and you will never gonna have burnout. You will definitely gonna have burnout in this specialty. You need time to rest. You need time to have some sort of escape which you have to build for your own self, so that you recharge yourself before going back
Mm.
again in. Because once you are inside the emergency department, you are going to make certain decisions which will definitely going to impact the life of the patient.
Mm.
So you cannot compromise on that. Okay, once I'm walking into the emergency department or even in ICUs, my family knows that he's doing something there which is directly impacting the patient's life. So they also even tend to call me only if it's extremely necessary. The benefit of this specialty is definitely what that once you are out, no one is going to call you back. uh, Once in a while, maybe they just if need some information, they would call you back, but you are not be called up again and again for the care of the patient. So that way, you have definitely extra time in your hand to recharge yourself. And that is where I feel like, emergency physicians or emergency specialists need to master their off our times to figure out that what they can do or what is the best for them. Maybe spending time with their family, going out with their friends, watching documentaries, or whatever way, reading books, even cooking, whatever helps them out to recharge themselves. That is what they need to do to once they are going in again, because it's always a war zone in there. So you need to be at 110% of yourself. You can't say that I'm down today and I will give 50% of my care to the patient. If you have a problem, definitely that all its emergency department is always a teamwork. So if in case anybody needs an emergency break, we do have this team system in which one or second guy will come up and take the place of the other one. But once you are walking in, you have to be 110% of your uh, medicine to be there. Your brain, your body, everything has to be there for that patient.
Absolutely. And I think thank you for sharing that valuable advice of yours. Now, lastly, doctor, what advice would you give to healthcare professionals aspiring to enter emergency medicine on how to build resilience in such a demanding field?
I think so. Entering is definitely right now in India is multiple ways.
Mhm.
You definitely have your um, the normal system of doing a postgraduate in emergency medicine. Along with that, there are a lot of fellowship courses too, which are also good enough to at least bring you into the emergency department and have a good knowledge also at the same time. So definitely, I would suggest any physician who is planning to come into this specialty that uh, don't just, even working in the emergency department is also good, but try to, at least do some sort of courses at the same time, because, just working and not having the knowledge getting enhanced parallelly will not be of a huge, benefit to you. One thing which is very important is that you have to immerse yourself. It is,
Mhm.
sort of like swimming. You have to dive in directly and you have to be at the bedside. You have to see what is happening. Lot of things you're gonna learn in emergency department by seeing, because this is a place where a lot of things are skill based. So a lot of things are happening at the bedside, which one or two or even three doctors are doing at the same time to save the life of the patient. So just standing there is also going to give a lot of knowledge to you. At the same time, if you are doing some sort of courses, it will help you enhance your knowledge. Other than that, there is a revolution in medical education too, which is called FOMED, free open access medical education, which has different number of websites which have a very good knowledge data bank for, especially at least for emergency medicine and critical care specialities. Like Life in the Fast Lane is a very good website. EMCrit is a very good website.
Mhm.
So, you can, before even entering, you can just go through these websites, start studying, start building your basics on this, so that you understand what is actually what you're going to see at the bedside. And even these websites are having that much deep level of knowledge that even after 2 3 years of experiences, people still use these websites. So personally speaking, if you are just working in emergency department as a junior doctor, definitely use free open access medical education websites to enhance your knowledge. Along with that, if you can do any courses which are available, go ahead, do it. Plus, if you are really willing to make up your career into this, go ahead with your PG training definitely, because end of the day, that is what gonna bring you to the top of this emergency department game. But coming at the bedside and learning at the bedside is the most important key over here.
Thank you so much, Doctor, for
Mm.
sharing that advice with everybody. And as we wrap up today's session, I would like to thank you for sharing your journey and invaluable insights with us. And then let me tell you that your dedication to your patients and profession is truly admirable. So thank you so much, Doctor.
Thanks a lot. Thank you, Advi.
Thank you. And to our listeners, I hope you enjoyed this engaging discussions. And emergency medicine is undoubtedly one of the most challenging yet rewarding specialties. And professionals like Dr. Siddharth has reminded us of the passion and perseverance it takes to save lives. So thank you, Doctor. And remember, if you're a healthcare professional that's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay curious, stay inspired, and most importantly, stay healthy.